Governor Asa Hutchinson sets a target date to hopefully get some businesses across the state back up and running. Good evening and thanks for joining us for Fox 16 News. I'm Kevin Kelly.
I'm Donna Terrell. The governor also said there are several steps the state has to take before that can happen. And yes, we must all continue social distancing, which is why I am now working from home.
So let's take a look at the latest numbers. Here's where we stand this evening. There are 1,695 confirmed cases in the state. That's up 75 from yesterday. Of those, 1,065 are still active. 93 people are in the hospital. That's 8 more than yesterday. 37 Arkansans have died from the virus, and 593 have recovered. At today's daily briefing, Governor Asa Hutchinson said he hopes the state will be able to open some businesses by May 4th. If the models and numbers support that decision and meet national guidelines, Phase 1 would then go into effect. Alexis Wainwright explains what needs to be done to make that happen and what Phase 1 might look like.
Friday, Governor Asa Hutchinson announced his projected date to start implementing Phase 1 of reopening the state's economy is May 4th.
I want to come back and talk about the gating criteria that the president announced yesterday.
Governor Hutchinson explained a 3-phase plan for Arkansas. Hutchinson talked about the 3 criteria the state is watching to start Phase 1 of reopening the economy: symptoms, cases, and hospitalizations. Dr. Nate Smith, who is the head of the medical advisory board that Governor Hutchinson appointed, announced 4 priorities for the state moving forward. 1, restoring Arkansas's economy in a timely fashion. 2, protecting most vulnerable people across the state. 3, maintaining health care and expanding public health capacity. And 4, prevent resurgence of COVID-19. This plan comes after Hutchinson had a meeting with President Donald Trump and all the other state governors. Hutchinson says the layout they were given helps him set the tone on how to move forward.
What it does for me as a governor is that rather than everyone charting their own path, there is some commonality that we can start with in the criteria that they offered. And so they set the criteria that every state can look at as saying, this is where you ought to be if you want to start opening businesses and releasing some of the restrictions.
Hutchinson says in order to get back to normal, everyone needs to continue to follow the CDC guidelines, like practicing social distancing, wearing a mask in public, and do not take trips that are not essential.
If you continue to beat the curve and you continue to have success, you can go on into Phase 2 and to Phase 3. And I think this is a good model, and I like the fact that the president said every state has the flexibility to adjust as needed.
Hutchinson says the state is still a ways away from a full opening. He also noted that there is some worry about moving too fast.
You want to get it right. You want to have the right balance there. And so we set it as objective. I think as Arkansans, we can achieve that. We can start lifting some of these restrictions, but we're going to do it very carefully.
During Phase 1, we would still practice social distancing. Some people would still telework, but if possible, people can return to work. Hutchinson also noted common areas would still be closed along with schools and youth activities. He says some elective surgeries could resume and large venues like movie theaters could reopen if they can keep people separated.
There's still going to be restrictions there. And so we're going to take it a step at a time based upon the public health data. So many things we think we can start based upon what we know now.
Washington State predicted that Arkansas would see its peak May 2nd, but Governor Hutchinson says if we continue to follow CDC guidelines, we can flatten the curve, and that would change. He says businesses should prepare to reopen. Reporting in Little Rock, Alexis Wainwright, back to you.